COVID continues to affect the lives of millions of Americans, our health, our activities, our fears, the surging infection and deaths, and those questions spoken and unspoken. Will I be next? Or if you already had it, will it return? Joining me to discuss these unsettling questions and fears are Deputy Commissioner of Health and Mental Hygiene, Dr. Torian Easterling, U.S. Congresswoman Yvette Clarke, and Pastor of God's Battalion Church in Brooklyn, Reverend Alfred Cockfield. Now, I know, Congresswoman Clarke, you're going to be talking about what government is doing about this COVID virus. Reverend Cockfield, you'll be talking about how it's affecting your church services as they're affecting church services all over the country. But let's begin with Dr. Easterling. There have been more than 250,000 deaths, and it's rising. Until a vaccine is available, what can we all do?
That's a good question, and the answer is something that we already know. The things that are going to keep us safe right now are really making sure that we are continuing to follow through on our messaging and making sure that we are wearing a mask and keeping 6 feet apart when we're out in public. I think we're going to have to continue to do the things that we also know around avoiding gathering, making sure that we're not doing any non-essential travel. We're heading into the holiday season, and we're also seeing surges in cases across this country, and certainly here in New York City. And this is concerning because this is also the time where, really we want to come together. We want to be with family, and we're going to have to make some really hard decisions and have some really hard conversations. And I'm sure others on this panel have had those conversations. I have certainly had that with my family. And we're going to have to make sure that even though we want to come together, that we're keeping each other safe. And keeping and protecting each other safe is making sure that we're limiting coming together and not gathering. The other thing that we really need to make sure that we're doing is getting tested. As we see the surge in cases, this is really the time to make sure that you do get tested, and knowing where your testing locations, what are the type of tests that are available is really important to make sure that your viewers, your listeners know the information and resources that are available to them.
Before I go to Reverend Cockfield, people who have had this virus already, there's some confusion about this. Can you be reinfected?
And so we're still learning the science and the data. Yes. There has been information about reinfection, and there have been scientific articles that have reported that there is infection. I think we have to be clear that there is no herd immunity. Yes, individuals do have antibodies, and yes, there are also information that is pointing to individuals that do have some level of antibodies, which is really based on the exposure to the virus, to the SARS-CoV-2 virus, that individuals that have been exposed do have some level of immunity to the virus, but it's also unclear about how long. So there are so many questions, and because there are so many questions, individuals really have to continue to be vigilant and do all of the effective prevention measures as well.
Congresswoman Clarke, we see pictures of so many elected officials in Washington not wearing their masks, led of course by your president, who I don't understand why he would do that. And there are so many people who are following him and who are being infected. What are you doing as a congressperson in Washington? And what are you Congress people doing to encourage people? In fact, do more than encourage people to wear their masks and to take the kind of actions that are going to be necessary to put some kind of brakes on this virus.
Let me first correct you. Donald Trump is not my president. However, I'd like to
He's not mine either.
let me just say that it's unfortunate that a public health crisis of this magnitude has been politicized by Donald Trump. He himself became a super spreader by holding rallies, being irresponsible, putting out propaganda, false information, when he himself was informed back in January about the lethal nature of this virus and did nothing. There are disciples of Donald Trump, and unfortunately, they're not relegated to just your everyday voter, but they're individuals who are members of Congress that have decided to take on this denial, if you will, many of whom are now becoming infected themselves. Let me say what I have been doing is being very clear and unequivocal in saying to my constituents and anyone who will hear me that it is critical that we protect ourselves and others. Yes, there's been a medical finding of a vaccine. However, there is going to be a process by which that vaccine is distributed. It's not going to happen overnight. We're not going to flip a switch and everyone will have access to it. The best way of protecting ourselves and our loved ones is by washing our hands, keeping our hands away from our face when in public, wearing a mask, and staying socially distant. And we're going to be disciplined in doing that for quite some time. I don't believe in pandemic fatigue. I believe in saving life, and we should all believe in saving life. And it's not enough to say, well, I'm young, I can get infected and I will recover. That is a misnomer as well. The science is not complete. From what we are beginning to gather about this disease is that it can do irreparable damage to organs, that you may not feel the effects today, but 5 years from now, 10 years from now, as someone who was infected may have some health complications down the road. There are those who have been infected that are what we call long haulers that continue to feel the effects of COVID-19 on their bodies. What we're saying is that we need to protect ourselves, our loved ones, and our community from infection. Full stop. And those who, my father says, those who can't listen, unfortunately must feel, and it comes at a very dear price.
Reverend Cockfield, I know that churches are suffering. I've heard of some churches that are closing their doors permanently. What is going on in the religious community in Brooklyn and outside? And tell us a bit also about what you're telling your congregation and what other pastors are telling their congregations.
So there's quite a big divide in the evangelical and in the Christian church, Catholic church, synagogue, my rabbi brothers, because some of them want to be able to have regular services. We at God's Battalion of Prayer, I am the executive pastor, I'm not the senior pastor, but we've made a conscious decision at all costs to protect our members. And what does that mean? That means that from March, we have, the March 15, we closed from having our regular services, and we just started in person 3 weeks ago, but we had a worship team, we had a band in, and we just had a recording of my father's message on Saturday and put in service. But now that we started services, we have a lot of protocols. You have to register in advance before Friday. You have to get on a list. You have to, when you get to the church, you have to get your temperature checked. You have to answer 4 or 5 questions about your activity over the last week, how you're feeling, any symptoms. We just have to protect our lives, because the problem is our seniors who are very vulnerable, they don't have technology to see the streaming services, and so they're the ones that really want to come to service, but we have to protect our, but then there's some churches that are struggling financially. There are churches that have, very small congregation, and so if you can only have 25% or even 25 people, but you have your service, your church only has 50 people, then you're dealing with a very economic problem. So there are churches that are struggling, if they're paying rent, they don't own their buildings, they don't have anything outside of Sunday services going on. it's extremely tough. Just like we've seen our small businesses in the street, in our boroughs, how they're struggling. Some are closing down. There are churches that will never open again. This is the reality of COVID-19. But at all costs, we want to make sure we save lives. We want to use wisdom as we re-enter in person. We have to use wisdom and make sure we protect our lives. And then one of the things, the main focus of our church was not to focus on the Sunday service, but focus on being a light in the community in this particular pandemic. What does that mean? That means that we made sure our food pantry opened back up. That we can serve people twice a week, 3 times a week to make sure they can get meals and get food. And so we had restaurants who gave us hot meals to give people. We want to be able to give people clothes and different things, masks. The governor so gracious to give us 57,000 masks to give out. And the different elected officials gave us hand sanitizer, different things, that we could be a blessing to people in the community, not who are members of the church, but just because they are in the community, they need a light, a place where they can get light, and that's what we wanted to be. So more than being a service, have service on Sunday, we wanted to be a lighthouse and a beacon in our community.
Dr. Easterling, apart from persons who are self-quarantining and people who have spent some time in hospitals, I know lots of people who've had the COVID virus. But my question to you is, what is your organization, what is your government agency doing about the mental health of persons who have had COVID?
Yeah, no, that's a really good question, Dr. Tate. One, we've had to make some alterations to our ongoing planning. We need to make sure that our core public health work can continue, and we needed to make some alterations by making sure that we were offering some of our virtual, making sure that we were offering some of our public health services virtually. And included in that was making sure that we can still offer some of our home visiting services, our mental health services, and deliver them virtually and connect with individuals, because these are critical services. And we want to make sure that individuals who are most vulnerable are still being connected. One of the things that we did recognize, and early on in the pandemic, is that we were messaging to everyone to stay home, and that also included individuals that still needed to connect with their primary care provider. That also included their behavioral health provider as well. And so there were a number of individuals, including those who were already prescribed and on methadone treatment, and we needed to really reconnect them back to those services. So we're seeing the spectrum. We're seeing individuals who are dealing with moderate stress, depression, and anxiety, to someone who's dealing with severe illness, severe psychiatric illness. And how do we ensure during a pandemic that those services can be put into place? And so that's really making sure that we're working with our behavioral health providers, getting them back into a rhythm where they can connect with their patients. And so that also means making sure that they have face masks, and also making sure that they have all of the protective gear to engage with the public. And also we're thinking about our public health approach. We have NYC Well, which is our call line, and we've seen calls go up during this pandemic of people accessing resources. And so we needed to make sure that we have those access points readily available as we did our reopening phase. And we know that we're continuing to see mental health and stress-related issues, not only due to the pandemic, but also due to other social and economic instabilities, because people are losing their jobs. People do not have food on their table. And so these are some of the other issues that we're also trying to wrestle with as well.
Okay, Congresswoman Clarke, talk about those issues that Dr. Easterling just spoke about. People losing their jobs.
We are seeing in our community the ramifications of trauma. Children traumatized, adults traumatized, witnessing the death of a loved one, knowing of the death of a loved one, having to adhere to these protocols, shutting down of school, reopening of school, shutting down of school again. All of these things have an impact on our mental health and well-being. They add to the stress and anxiety of parents who are essential workers and must go to work, and who will look after their children. And that's why it's critical that the Congress act right now. There is so much that we need to do to bring relief to the American people. You know, we passed the HEROES Act here in Washington, D.C., which was a comprehensive lifeline to the American people. It provided funding for our heroes who are our frontline medical professionals who, you know, are also experiencing many of the same things that we're talking about in terms of the general public. It provides hazard pay for those individuals. It supports testing, contact tracing, and treatment. You know, we talked about the vaccines, but there are also treatments that can be utilized to help people actually get through having been infected, monoclonal antibodies and things that are coming online now. We want to make sure that the most vulnerable communities in our nation are receiving their treatments and that they're prioritized as we see the rollout and the distribution and the mass production of these different treatments and vaccines. It provides for additional direct payments to families. The unemployment rate in our communities have skyrocketed. You know, communities of color are the last ones hired, first ones fired. And so, you know, unemployment benefits are extended. It protects the payrolls of our small businesses who are really, really struggling right now. It ensures worker safety because, you know, workers have to go in as essential workers into spaces and take on the risk of providing these services. So there's a lot that is wrapped up in what we're doing. And what I'm saying is that we all need to be advocating for the passage of the HEROES Act, and it needs to happen now.
We have run out of time, unfortunately. We are going to have another program when we get closer to the vaccine, because they have no idea when this vaccine is really going to be available and if it's going to be available to everyone and who are the people who are going to be able to get access to the vaccine first. So we're going to have you back. So I want to thank you, Congresswoman Yvette Clarke, Pastor Reverend Alfred Cockfield from God's Battalion Church. I have to visit your church again, but then this will be after COVID, and when I can be welcomed back, get to shake your hands again. And Dr. Torian Easterling, it's good to see you again and good to have you on this program. Thank you very much for being on Brooklyn 45.
Thank you.
And now over to Alonta.
Thanks, Sam. Joining us this evening is Teyha Ali, a current 8th grader representing Flatbush, Brooklyn, New York, attending Arthur Cunningham Junior High School 234. Welcome to Brooklyn 45, Teyha.
Thank you for having me.
Our pleasure. So how is the school year going so far as an 8th grader?
It's going pretty well. There are a bit of challenges here and there, but overall, it's pretty good.
Go ahead.
As for right now, all my classes are remote, but I did sign up for hybrid learning, but the area that my school is in is considered a red zone, so we will have to wait.
Oh, okay. All right, but all in all, everything is going well.
Yeah.
Okay, so since we are at the beginning of the fall school semester, we're going to talk about your 7th grade year because that's the year we want to highlight you as an academic achiever, a scholar. Is that okay with you?
Yeah.
So along with other subjects that you've taken, which most students do take in the 7th grade, you honors English, ELA, right? Mathematics, honors science, and honors social studies. Is that right?
Yeah.
So what was your grade point average and what is the strongest subject in your 7th year?
My grade point average was about a 93. I would say that my strongest subject was actually math.
Mm-hmm.
Even though it was one of the hardest, I still tried my best and I gave it my all to get the grades that I wanted to get.
Okay, so what would you consider your favorite subjects?
I prefer history because I always found it interesting, and I like to see other people's perspectives that they have in history. And I also like biology because it's kind of a mystery, and I like to see how things start and what causes other things to happen.
Mm-hmm. Okay. So you have two subjects, history and biology. Okay, good. So along with being an academic achiever, you've shared that you are quite some musician and that you're also in the school band, right?
Mm-hmm.
So tell us about that.
Well, right now, the instruments that I play are trumpet, piano, guitar, and a little bit of baritone horn or euphonium.
How many instruments is that?
4.
4 instruments. Wow. And which of the 4 are your favorite?
I would say I like trumpet because when I'm playing in a band, it's easy to collaborate with others. But if I'm playing independently or if I'm playing a solo, I would prefer piano because I can feel the music more.
Okay, so you can feel the music more when you're playing the piano solo. Okay, I would love to hear you play. When did you realize that you were inclined musically?
I would say 2nd grade because that was when I first started taking strings for violin.
Okay. All right. So let's talk about your greatest accomplishments. What would you say they were?
I would say what I was able to accomplish musically. For example, Jazz at Lincoln Center, I took the program for 2 consecutive years. I also was invited to play in an honors band last year, but it got canceled because of COVID. So I was looking forward to that. I was also in the band for 6th and 7th grade in my school, playing euphonium for both years.
Now, you call the instrument a euphonium?
Yeah.
Okay, not a music person. What in the world is a euphonium?
A euphonium is kind of like a mini tuba. It's also an octave higher than a tuba. But other than that, they're practically the same thing.
Okay. So you see yourself in the future doing something related to music?
Yeah.
You're really passionate about music. Okay. So prior to COVID-19, those constraints, how did you manage your academic and your instrumental time? Since you're talking about several instruments and you are an academic scholar, so how were you able to manage that time?
I don't do it very well, but I still manage to get it done. I usually do my work first and then I do my instrumentals later.
Okay. So your work first, then your instrumental piece? Okay, now I understand that you're taking private lessons too, correct?
Yeah.
And?
Trumpet.
Okay. Private lessons in trumpet. I love it. So really quick, biggest challenges facing our nation today. One word.
The government.
Government. So if we have more time, we would definitely delve into that and say more about that. So Teyha, thank you so much for gracing us with your presence today. We so look forward to hearing about your studies this year, your 8th grade experience, and we'd love to hear more about where you're going with your music. So keep in touch, okay?
Okay.
And thank you for being on the show. So
Thank you.
there you have it, Teyha Ali. I'm Alonta Rydon, and back to you, Sam.
Thank you, Alonta. And now over to you, Regi.
I could remember when I was growing up, gathering together with my friends in front of the house parties, holiday family gatherings on Thanksgiving and Christmas, going to school, hanging out with my friends, and going to see the Knicks play basketball. But times have changed, and so must the lens through which we see the world during this pandemic. No longer can we take advantage of partying like it's 1999. And I don't think millennials get that. The pushback against public gatherings, social distancing, mandatory face masks, quarantine, online schooling, Zoom calls instead of linking up with your friends, and traveling at your own risk is impacting our success in beating this pandemic. It's time, millennials. It's time to unfriend and unsubscribe to social gatherings. It's time to get likes for your quarantine and not for how you turn up at a party. And remember, you're not stuck at home, you're safe at home. It's time. Live that quarantine life and live to see another day. My name is Regi Brown, and this is Brooklyn 45.
Thank you, Regi. And to our viewers, we invite you to partner with Brooklyn 45. You can do that in several ways. You can suggest topics for us to discuss. You can let us know about issues that are taking place in your community, and you'd like us to talk about those issues. We would love you to become a supporter of Brooklyn 45. Go to our website, www.brooklyn45.com, and become a supporter. Go to the donate button and click on donate. We need your support, as I'm sure you need the information that we provide to you, and your support helps us to continue to provide information to you. You can also go to our Facebook page and like us. A lot of our programs are on YouTube. Go to our YouTube site, www.youtube.com/Brooklyn45TV. Don't forget the TV. And look at our programs that are available on YouTube. On behalf of our Brooklyn 45 team, I'm Sam Tate.